Acting Chief Medical Officer in the Ministry of Health, Dr. Francis Martin, says health officials are increasing their surveillance to prevent community transmission of COVID-19. In an exclusive interview with GBN, Dr. Martin said that people will be contacted and is looking for the public's assistance as they aim to prevent the transmission of this deadly virus.
Well, there are people constantly calling with symptoms, and most of it has to do with the flu. But what we're doing is not anything new or different. That is what surveillance is. So whether they have the symptoms or not, we're still going to identify them and make a decision as to whether or not they should be tested. Not everyone has been contacted yet, but people are going to be contacted. In addition, the Regional Security Service, RSS, is going to be landing in Grenada for the first time today, and the purpose is for carrying samples that we've collected to be tested in Trinidad in an effort to identify additional cases and also to help us confirm whether community transmission has occurred.
Like every country around the world grappling with the spread of COVID-19, Dr. Martin said it's an interesting time for Grenada, which confirmed its first case on Sunday. He told GBN increased surveillance measures being implemented will mean additional support for community health nurses.
What we're not going to do is to give her some support in terms of giving her manpower to be able to go out into the individual villages and communities to identify people who may have been exposed. And once we identify them, then first of all, educate them. Secondly, ask them to stay indoors, lock down. And thirdly, depending on their clinical presentation and depending on some other aspects, test them if there needs be.
Cherry and Blackman Stephen, GBN News.